Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. The core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I'll be your host. Today's guest is Dr. Paul Thomas. Dr. Paul Thomas, affectionately known as Dr. Paul, received his MD from Dartmouth Medical School in 1985. He's been board-certified pediatrician from 1991 to 2021 and board-certified in addiction medicine from 2010 to 2021. He's a pediatrician whose clinic, Integrative Pediatrics, care for 10 to 15,000 children. He is an author of The Vaccine-Friendly Plan, published in 2016, The Addiction Spectrum, A Compassionate Holistic Approach to Recovery, published in 2018, and COVID-19, Life-Saving Strategies, The News Media Will Never Tell You, which incidentally was banned on Amazon, so he had to self-publish it at Smashwords. Dr. Paul has over 1.5 million subscribers on his YouTube channel, youtube.com/user/Paul Thomas MD. After publishing the world's largest peer-reviewed vaxxed versus unvaxxed study from real-world data in his practice on November 23rd, 2020, the Oregon Medical Board responded by emergently revoking his medical license. He responded by starting his new weekly show, Against the Wind, that can be found at doctorsandscience.com. The past 3 years, the Oregon Medical Board has relentlessly brought false charges and claims against him that his book, his research, and his honoring informed consent is a violation of the standard of care. He faces a 2-week-long trial in January with projected costs in excess of $250,000. This fight is not just for his medical license, but for medical freedom and humanity. Dr. Paul's Fight, that's drpaulsfight.com. You can donate, pray, share. This is our fight, and Dr. Paul has vowed to fight on to victory, but he cannot do it alone. It's a daunting task, and we need to stand up together in order to be able to help him in this challenge. So, Dr. Paul, it's such a pleasure to have you on the show today, and thank you so much for spending this time.
Oh, thank you, Michael, for inviting me on your show and for that kind introduction.
So tell me a little bit about this medical board attack. You know, what is all of that about? I mean, all you're doing, you're just presenting real world data that is medically necessary, medically important to make sure that people are using medicine in the best possible, safest way.
Yeah, so the medical boards in general have this duty to protect the public from dangerous physicians. Now, traditionally, go back 2-3 decades ago, that would be physicians who were working impaired, under the influence of drugs or alcohol, or physicians who were perhaps sexually abusing their patients, maybe under anesthesia or otherwise. Those were the types of physicians who would tend to be scooped up by a medical board review. But in the last decade or two, there seems to be this shift where medical boards are actually trying to sort of enforce a standard of care that is mainstream dogma and not tolerant of, creative, integrative medicine approaches, basically. I mean, the kind of care you give in your office, the kind of care you talk about on this radio show or this podcast, is exactly the sort of things that are now being scrutinized by medical boards. My own situation, I have actually never had a successful lawsuit against me in over 30 years of very busy pediatric practice. I supervise several mid-levels. I used to teach residents and medical students. When it comes to what to do as a doctor, I think I've got that pretty dialed in. But this medical board issue started after I published that book in 2016, The Vaccine Friendly Plan. I think many listeners might be familiar with the fact that vaccines have become very controversial, and it seems the establishment is working very, very hard to have a one-size-fits-all vaccine program. That is in the form of the childhood vaccine schedule put out by the CDC, and then, of course, everybody's now familiar with the COVID vaccine or shot. It's hard to call it a vaccine. It doesn't meet the usual definitions of a vaccine. But anyway, mandates are coming along for that, and that's now starting to affect all people. It used to be just childhood vaccines were the problem. But back to the board question that you asked me, it's sort of bizarre to me why they would not want me to do research. I mean, research data should be the foundation of all medical decisions. I mean, you hear on the news, we follow the science. Well, that is just a sleight of hand, a convenient use of that term, because most of what we're hearing in the news is folks are reading a teleprompter, and the only science they're following is very narrow, what we call cherry-picking articles that are almost always poorly done studies that don't look at the right outcomes, don't have proper placebo controls, things like that. But the board's emergency suspension actually didn't mention my research, so it's only an assumption because of the timing of it. The timing was just so bizarre. I had a couple ongoing open cases that I was responding to. The usual procedure is they send a complaint, I respond, I don't hear for months. They send another complaint, I respond, I don't hear for months. And then more recently, it's been complaints coming at me, sometimes weekly.
And so with that, I mean, when you're responding, I mean, are they satisfied with the response and then just comes another complaint, or is it the kind of continuation of the same issue that you responded to?
Right. So what's very unusual about this go-around with the board, I had one other go-around with the board when I first opened my addiction practice, and it was just triggered by a very upset patient who was trying to extort money out of me, basically. It was a person I was trying to help get into a treatment program, and it just wasn't happening fast enough for this person. They got very upset. That ended up being closed, and that's the usual process with the board. They have a complaint, you deal with it, you answer it, they slap your hand or not, and they close the case. Well, what's happened this round, going back 3-4 years ago now, they don't close the cases, so they just leave them hanging. And so I have this long list of, various complaints. I am now under a gag order. I can't give specifics of complaints, but the general gist of almost every single complaint has to do with informed consent, because they're making a complaint that my patients are not following the CDC schedule, therefore I'm to blame for that. When in fact, what's happening in Portland, Oregon, where I practice, most other pediatric offices are kicking people out of their practice who won't follow the CDC schedule. Those patients end up many times finding our clinic. And so over the last few years, we've just had this growing number of families joining our care who don't want to vaccinate at all. And I started noticing that, wow, these unvaccinated patients are really healthy. And so it was February of 2019, the medical board sent a letter asking me to prove that the vaccine-friendly plan was as safe as the CDC schedule. So they were actually asking for data. And so I hired an independent outside expert. He came into my office. This guy was a pediatrician, neonatologist by background, an informatics expert. I mean, this guy knows data, basically a data nerd. I said, find every single patient that was born into this practice from the day we opened till that particular day when we were going to close the data set, February of 2019. So I'd been open for over 10 years, and he pulled every single chart. We didn't exclude anybody. We looked at all medical diagnoses and we looked at their vaccine status. And that was the famous study that was then published. So I gave the board not just the data, but I gave it to them in the form of a peer-reviewed published article that was published in the International Journal of Environmental Research and Public Health. It's a long title, but it's basically the vaxxed-unvaxxed study that the world's been waiting for and asking for that the CDC has refused to do. And the title is Relative Incidence of Office Visits and Cumulative Rates of Bill Diagnoses Along the Axis of Vaccination. So basically we looked at all visits that had a diagnosis, and when you come into an office you get a diagnosis. So we just tabulated all of that and compared it to how vaccinated you were. And for the data analysis, we actually, to make sure we were comparing apples to apples, we age matched a vaccinated patient who was the closest age match to each unvaxxed patient. They were matched together so that we were really looking at the same age. And then that's what was tabulated in the famous table that shows in orange over 10 years. The conditions are just skyrocketing over those 10 years, and it's almost flatline, non-existent for the unvaxxed kids who were documented in the blue line. And I mean, this held true for everything from the allergic things like asthma, allergies, allergic rhinitis, to the behavioral things like ADD, behavioral issues, to infections. We looked at respiratory infections, ear infections, eye infections, all infections. And then we also found the same thing for anemia. What was a couple of fascinating things was the ADHD was non-existent in our unvaxxed population. And I think for listeners, since you don't get to see these graphs, it's maybe important to understand that this data that I've published is being real-world data out of an actual practice is a very, very important piece of information, because until this was done, we had survey data. Not that that's not important. Mawson was the first to publish a really important survey data of vaxxed, unvaxxed that showed basically the exact same thing that I've shown with this real-world data. There have since now, in the last couple of years, been a couple other important published studies comparing vaxxed, unvaxxed, done by Brian Hooker and Neil Miller. And then there's a huge data set at thecontrolgroup.org. So listeners can go to thecontrolgroup.org, and it's like a 500-page document, but it's got some beautiful graphs that you can also see. That was done by survey of 48 of the 50 states, and similar findings to my data. So we now have multiple different studies showing the same thing.
Which is, I mean, it's so important to have, then it can't just say that it's you that's kind of creating these numbers, because you have similar data and they all match. So let's take a quick break. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Paul Thomas. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Paul Thomas. He's the author of The Vaccine-Friendly Plan and also The Addiction Spectrum, a compassionate, holistic approach to recovery, and his third book, The COVID-19 Life-Saving Strategies the News Media Will Never Tell You. So, Dr. Paul, I mean, one of the things that you want as a patient when you go to a medical doctor, a pediatrician, then if for your child, is that you want that doctor to individualize the care based upon your needs instead of looking after, like a cookie cutter approach, which seems to me that is what the CDC plan is doing, and what you really brought forth was then showing that if you do it this way, you have a better outcome. But obviously, you want the choice to be in the hands of the doctor and in discussion then with the patient, not just having the CDC telling everybody that this has to be done, because the CDC is not the one treating the patient. Correct.
And in fact, the CDC can only make recommendations. They do not have a license to practice medicine. And I think people get that confused. Oh, well, the CDC says this, that, and the other. Well, they can only make recommendations. They cannot treat, and they should not treat. Individualized medicine, as you point out, is the cornerstone of good health care, because we, the physicians, we, the doctors, sitting there talking to a patient, we know their and can obtain their family history. We can examine the patient. We can factor in variables that are important to this particular patient because nobody knows their child better than their parent. And obviously, a one-size-fits-all recommendation from the CDC just negates anything that the doctor-parent combo, right, can come up with that might be fine-tuning what really makes sense for that child. I mean, an easy example for most people to understand is hepatitis B vaccine for newborns. The history of that is, you catch hepatitis B from sex and IV drug use. We used to give that vaccine to teenagers who are considered high risk for being promiscuous or, IV drug use. And then it became fairly routine that all teenagers in America were getting that vaccine. And then in 2000, around 2000, 2001, there was a big push to move that vaccine to the newborn period. And the truth of the matter is less than 1% of mothers giving birth in America have hepatitis B, which that's the only way a baby can get hepatitis B is if their birth mother has hepatitis B. So, yes, those are the babies that should get that vaccine, but that's less than 1%. And instead, 100% of babies born in America get the hepatitis B shot right at birth. I think this is one of the major reasons we see infant mortality in the United States is worse than almost any other industrialized nation. We are at the bottom. We also have the most aggressive vaccine program, and many countries around the world do not have hepatitis B in the newborn period because it just doesn't make sense when we already know the hepatitis B status of moms. OBGYNs do a great job of screening that. So that's just one example where, yes, I would give a hepatitis B vaccine to that one baby that's ever been in my practice whose mother was hepatitis B positive. Literally, I think it's been one in my whole career. But the rest of these babies, to me, it's more harm than good to give them a shot with 250 micrograms of aluminum at birth when they don't need it, and the adult max for aluminum is 50. So you're giving 5 times the adult max of a known neurotoxin that disrupts the immune system, triggers autoimmunity. It just makes no sense.
So here they're going after you because of informed consent. And to me, informed consent would mean that you would communicate the risk versus benefits of any kind of treatment that you are giving. And here, you did these studies then showing that there is a risk with vaccine. It's not just harmless. There's a risk. And then so you need to then balance out, the risk versus benefit. So it seems like they're going after you for not doing, or they're going after you for actually doing a great job in an area that other doctors should do that they're not doing.
I agree with you. It's not a popular position that I hold. Strangely enough, most of my peers, most other doctors, especially pediatricians, are in favor of the CDC schedule. They promote it heavily as if it's the most important thing they can do. So families who want to individualize vaccines or not vaccinate at all find themselves at odds with almost every pediatrician out there. And so what most people do is they just stop going. They just don't even seek a doctor. And with the massive push for mandates that's coming with COVID, we have patients who literally will not go to the hospital unless they're at death's door for fear of, being forced to do things in the emergency room or if they get hospitalized.
Yeah, and I see that here locally where I'm at as well, and I'm actually trying to figure out a way where we can kind of bridge that gap, so people feel like they are not medically discriminated against, when they enter into the hospital and are forced medical care that they not choose to, or because they're not choosing to, then they get subpar care. That becomes a really important component, I think, in today's world.
Yeah, no, I think we're going to have to, those of us who are aware of what's going on and the need for, a parallel system, because the current medical model is pretty broken. I mean, what we have is medicine by protocol, and if you deviate from that protocol, which is generally somewhat or not, if not some completely influenced by pharma. So you have this consensus medicine where industry promotes a certain approach. So we're talking about vaccines. So in this case, we've got industry promoting a certain schedule, and of course, with vaccines, we have the added problem of them being immune from liability. So you've got a product that's being promoted, and not just promoted, it's being forced on America's children, because most states will prevent you from going to school if you don't have the full schedule. And most parents are not told that they have ways to get an exemption, whether it's philosophical, religious. Very few doctors can write medical exemptions anymore. And so that's sort of a lie that's told, oh, well, your doctor can give you a medical exemption if you want. No, they can't. In almost every state, doctors who write medical exemptions are losing their licenses. I mean, just across the board. California and Oregon are particularly heavy-handed on medical boards, coming down on doctors who might write for exemptions. So, but there are mechanisms in most states for parents to get a philosophical or a religious exemption. Therefore, you could individualize your care, but the bulk of the pediatric community, pediatricians at large, are just promoting the CDC schedule as the only thing you should do, can do, and if you won't do it, they show you the door.
Yeah. Let's take a quick break. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Paul Thomas. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Paul Thomas. So we discussed hepatitis B vaccine a little bit, and kind of that there's a certain need. So it's not like you're anti-vaccine, even though they are just like vaccine. They've changed the definition of it. Now they're wanting to change the definition of what it means to be anti-vaccine, which means that if you are in any way wanting to deviate from the CDC schedule, it seems like you're an anti-vaxxer now. So what about the other, like tetanus? I mean, is that something that's important, or, and how important is it for the immune system of a child to be vaccinated, at that young age? It does all of, what are your thoughts about that?
Yeah, very good question. So interestingly enough, because this was in a public record, I can talk about it. When they yanked my license emergently on December 3rd, 2020, one of their complaints was that I had caused a child to get tetanus and almost die. Here's the real story about that case. So this was a big case. It was in the news. I was misrepresented in the news. The true story was this was a young man, a kid. He was in his early teens, I think, his age, who lived over an hour away from my office. His family, he himself, they were not my patients. When he acquired tetanus on their family farm, got a big gash in his head, and the family, just kind of being farmers, they just sewed him up, cleaned it up, sewed it up. Well, you and I know that tetanus is anaerobic, so a closed wound, if you have tetanus spores in there, that's what's most dangerous. And indeed, he ended up almost dying from his tetanus. He was put in the hospital here in Portland, Oregon, OHSU, hospitalized for 3 or 4 months. It was as he was leaving the hospital, he survived it. They wouldn't let him out of the hospital until he got a pediatrician. No pediatric office would take him because he's unvaccinated by parents' choice. So I get this desperate call from this family, please help us. We're trying to get out of the hospital. We have to establish care with somebody. Nobody will take us. I said, sure, come on over. So he comes from the hospital right to my office. I get to meet this young man who can barely walk with all the effects of his severe tetanus infection. He's fine today, by the way, but that's the story. So I did not know the patient, but because he saw me 4 months after his tetanus infection, it was written in a way that I was responsible for that. And so the media took that and ran with it. And so it's interesting you bring up tetanus because of that backstory and my interaction with the board and how they manipulate things. So tetanus is very, very rare, first of all. I think I haven't looked specifically recently, but I think there's less than 100 cases in the whole United States per year of severe tetanus, if I'm not mistaken. If you have a wound that you can clean adequately, you won't be at risk for tetanus. That said, there are these rare cases of severe tetanus and rare deaths, and it is, in that regard, somewhat of a vaccine-preventable disease. Now, your infant, you were asking about the age and timing, for example. Your infant's not going to be out in the horse barn, stepping on rusty nails, presumably. So why would we necessarily need to give that vaccine as early as we do? So that's the DPT shot. The T is the tetanus, which is traditionally given at 2 months, 4 months, 6 months, boosters at 18 months, and again at 4 to 6 years of age, and then every 5 to 10 years after that. Certainly one could individualize that schedule if that was your desire, and do it perhaps in a more in a way that might be safer for your child and their developing immune system. But, those specific individual approaches, that's the whole beauty of individualized medicine rather than a one-size-fits-all. That's where you sit face-to-face with a family and you talk about it.
And that's where, it almost seems like they're cutting out, or that the doctors just become drug pushers in a very specific way. And if they don't do it in a certain way, then all of a sudden they don't get to be part of the system. So that, like you were saying, that interaction with the patient, and then measuring the need. Maybe they're a city person and they're not crawling, or they're not running around in a barn dealing with horses and rusty nails. Then maybe they don't need the tetanus shots, and maybe the risk is higher from the effect of the tetanus shot than getting tetanus.
That certainly could be. Yeah, you mentioned earlier about me being labeled an anti-vax person, and that's so true. And yet I have vaccines in my office, and when families want to do vaccines, we honor that wish, right? I mean, that's part of informed consent. And I know people who really, really don't like vaccines, and there's reasons not to like them. Let's be clear. My data is sending out a large warning signal, like we got a problem here with our childhood vaccines. But nevertheless, if a patient comes to my office and they want the vaccines, and you go through that process of informed consent and educating them and answering their questions, we do them. They're going to get them anyway. If we don't do them, they're going to go to another clinic and get them anyway. And we provide, integrative medical approaches that maybe they want, but sometimes people want some vaccines as well. So, I think the anti-vax label is just given to people, as you said, who don't endorse and promote and enforce the full CDC schedule, which is, has its problems, as we're discussing.
Mm-hmm. Yeah. Let's take a quick break. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Paul Thomas. He is the author of The Vaccine-Friendly Plan, also The Addiction Spectrum, a compassionate, holistic approach to recovery, and his third book, COVID-19, Life-Saving Strategies the News Media Will Never Tell You. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Paul Thomas. So we've been talking a little bit about some of the other vaccines, like hepatitis B, tetanus, and obviously right now it is really a big deal is this COVID shot. I mean, like you said, it doesn't really qualify for the traditional definition of vaccine, so they had to actually change the definition of vaccine to include this COVID shot or jab, or whatever we would call it, or genetic manipulation, as some other people say. So what are your thoughts in regards to this shot being mandated onto children? I mean, how important is that?
So this is a tragic mistake, in my opinion, and I'm not alone in that. People like Dr. McCullough, who's been very vocal on a lot of around the country. I mean, he's an incredible expert, has published multiple papers on this topic of COVID, understands it like almost no one else. He's sat on committees that would typically assess safety and risks of drugs, including vaccines, I believe. Anyway, yeah, he went from being completely pro-COVID vaccine to completely against it as the data came in. And here's what the data is showing for children. Children are simply not at risk of death from COVID, from SARS-CoV-2. They just do fine. I have a practice of over 10,000 patients. I haven't had a single, not one child end up in the hospital. Certainly nobody's died. To my knowledge, we haven't even had a single child go to an emergency room. The kids I see with COVID in my practice have a common cold-like illness or no symptoms at all. I mean, they just do fine. The parents tend to get it a little worse, and then, of course, the very old are the ones who are at higher risk. So you've got a situation where here's an infection which is harmless to children. Right there, you should pause before you do something that might harm them. And now we know this vaccine is extremely dangerous. It can kill you. It definitely is causing myocarditis in children. I've already had a patient in my own practice hospitalized for myocarditis. This was an early teen kid who went into a pharmacy with his parents, of course. They wanted the shot. They gave it to him, the COVID shot, and he ends up in the hospital with myocarditis. I mean, that is typically permanent heart damage, and it's happening. Your risk as a child, this was published in a peer-reviewed study, is 4 to 6 times as greater of being hospitalized for myocarditis than it is from being hospitalized from COVID itself. So this shot is causing, just on that one issue, so much more harm than doing nothing at all. So this is a subset of our population that does not need this vaccine, should not get it, in my opinion. And it's a disaster of epic proportions that we are considering it. We've gone beyond considering it. It's already happening. It's already been approved to 5-year-olds, and they're targeting right down to 6 months, like they usually do.
So what do you feel? You talked about myocarditis. I mean, we know that this jab has not been studied very long at all. I mean, it's new technology. They just rolled it out, under emergency orders, and they rolled it out. So it's almost like they're doing the study worldwide as we go, and just to kind of see what happens. So what are your thoughts in regard? What we're going to see a year from now, 5 years, 10 years, in regards to everything that's going on currently?
Right. Well, we know we're going to see more deaths. We know we're going to see more myocarditis, and those are just two of a host of things that this jab is causing. It's causing an inflammatory response. It's causing spike protein can circulate through the body, and wherever it attaches, your immune system then attacks, and so we have this huge range of autoimmune conditions that I think will be exploding over the next few years in people who've gotten this jab. And autoimmunity, as you know, you work in an integrative practice, is one of the most difficult things to stop or to treat, because it's the immune system that's attacking self. And you don't want to turn off the immune system, then you're in other danger, right? If your immune system's toned down too much, you get cancer and other infections. But when your immune system is attacking your brain tissue, now you've got brain fog, or who knows what it's going to cause in the elderly, dementia or whatever. But if it's attacking other parts of your body, you're going to have problems there. We're especially concerned about the reproductive capacity of people who get this COVID jab, because we're finding this spike protein has a way of concentrating in the gonads, so your testicles for a guy and your ovaries for a woman. And so children and adults of reproductive age, will you be able to have children down the road? We simply don't know. They didn't do the animal studies to even look at this question, but it's a big, big concern. Anybody who's even thinking should realize that we're at great risk for that being an issue.
So it's almost like it's birth control then on all our children. I mean, you're reducing then their ability to procreate, and so that way it seems like we can then control the amount of people living on Earth.
Well, you've probably read those theories that are out there that's one of the main reasons that this was done. I can't really speak to that, but will it have that effect? It sure seems like it will. Yeah,
and I know in my own practice, and also speaking to other doctors in regards to cancer. And it seems like it really downregulates the immune system to be able to address other infectious agents and also control cancer cells activity within the body. So we know that it's...
You're seeing that in your practice already?
I am. Yeah.
Yeah. I've had several friends who people in their family or friends who've had aggressive recurrence of cancers after getting the jab. I mean, sometimes within weeks, big time cancer recurrence. And so I'm hearing that as well from physicians and other people.
Yeah, it's atrocious. One thing, just as you know, as a pediatrician, we had this we're masking and social distancing, and what are your thoughts in regard to the impact on children with the masking and social distancing? I mean, it seems to me that these are part of their learning and development to be able to interact closely and also see facial expressions and so forth. I mean, what are your thoughts in regards to that?
I think masking kids is tantamount to child abuse. It is absolutely a horrific thing we are doing to these kids. I have a hard time breathing with a mask. If I'm a kid and my parent is basically enforcing that I wear this mask, I mean, they're really working to train kids to be able to tolerate this mask. We are seeing more anxiety, I mean, severe anxiety in younger and younger children than I've ever seen before. And I have no doubt it has to do with the physical masking itself, but also the social impact that you're referring to. It's a fearful world if everybody's walking around in a mask because they might be catching or giving an infection to somebody else, and people, I mean, you'll see people just sort of sidestep another person on the sidewalk who isn't wearing a mask as if they're like, the plague. And it's all unfortunately unnecessary because kids don't die from COVID. Kids don't hardly even get sick. Kids should be unmasked, no social distancing. They should have been in school throughout the whole thing. We didn't know in the beginning because they did such a masterful job of getting the whole world scared of this potentially deadly virus that it perhaps was a reasonable initial response until we knew what we were dealing with to mask up and social distance and isolate and quarantine and all those things. But now we know. So come on, folks. Kids should be back in school without masks, without social distancing. They should be allowed to run, hug, play, whatever, spit on each other. They'll be fine.
And I mean, we are used to, I mean, the kids, they go back to school, they get sniffles, they, get runny nose, and they maybe catch a cold and they get over it, and then they're all fine. But now it seems like because of this fear, as soon as a child has a little bit of a sniffle or what we normally saw is just catching a little cold, now it's this emergency alert, and to the impact of children, like you're saying, to live in this fear, it seems, I mean, like that cortisol, it has to rewire the brain, so that you are not able to learn and not develop as well as you should.
Yeah, no, it's absolutely real what you're talking about. And if you're a parent listening, please try to deal with your own fear as well, because kids can really pick up on parental anxiety. And so if I've got a kid in the office with a parent who's super anxious, that kid's anxious. I mean, they just are. Your person who's supposed to be keeping you safe is nervous and scared. Well, then there must be something to be afraid of. So I think it starts with us, parents. We have got to start waking up to the fact that this thing is not scary. It's not dangerous. Yeah, there are some people who are super, super old at the end of their lives, or some people who are super high risk, the morbidly obese, the people with really bad high blood pressure. There are some conditions that seem to put you at greater risk. But for a healthy person who has an adequate vitamin D level, you have nothing to worry about. It's time to make sure your kids know that this world is going to be fine. And it starts with us, the adults, who should know how to discern between misinformation that we're getting on the news and what's reality. But it is difficult. My own parents got the vaccine. If you watch the news, you can flip through the channels, and they're all saying the same thing. And my mom even told me, says, "Well, Paul, how can you be right and everybody else is wrong?" Well, everybody else, they're all getting their news from one source. They read a little teleprompter, and that one source is profiting on this vaccine rollout in a way we've never seen before. So this is a manipulation of our whole world in a way I've never seen before. It's almost unbelievable.
Yeah, it's really fascinating, the mass hypnosis that seems to be taking place. And one of the things, in regards to that mass hypnosis, I mean, they keep kind of perpetuating the fear with now it's this variant, next variant, and so now we got this Omicron variant. So I mean, what do you think? I mean, in regards to variants and the vaccine, the jab, I mean, are they even relatable? Meaning, because I know with the flu vaccine, you have to change the type of vaccine every year. So how come we don't need to do that with this?
Yeah, no, these variants are very harmless compared to the original strain. Kids could handle the original strain anyway. For these new variants, Delta and this Omicron, it's like a nothing, even for most adults. And the data's coming through that the unvaxxed are handling these variants very well. So it's not what you hear on the news in America. You're still hearing, oh, it's a disease of the unvaxxed. But they're doing some crazy manipulative things to come up with that data. In other words, you're considered unvaxxed until 2 weeks after your second dose, which means for at least 6 weeks after you've been vaccinated, if something happens to you, you're blamed as if you were unvaxxed. I mean, it's just crazy. Or all the side effects from the vaccines get tallied as unvaxxed. A lot of different things they've done that are manipulating the data. But the actual good data that we can find now in different peer-reviewed journals around the world is showing that this is a big nothing, these variants, for people who are unvaccinated. And if you've been vaccinated, you can stop. You don't have to keep, just because two shots failed to give you protection, they're saying you should take a third and then you should take a fourth. Or why don't you just let your natural immune system take over like it should and could and can? You can stop the madness at any time.
So, and something that doesn't make sense to me in regards to the jab, I mean, here because they're seeing that it's a spike protein, the existence of the spike protein that seems to be the bigger aggravating factor why people are having health issues, spike protein on the virus. And so now you're actually injecting more of the thing that you want to avoid and thinking that you're going to be better off.
That sounds insane to me as well. And what's even more scary is that because of the way this messenger RNA technology is working, you're also turning your own cells into spike protein manufacturing cells. So your own body is making the toxin that could kill you. Why would you want to do that? It just does not make any sense. I think the other thing that people don't understand in this particular virus, your innate immune system, the inborn, the T-cell arm of your immune system, which is, by the way, is very strong in kids. I think it's partly why kids are doing so well. That's what takes care of this virus. By the time you need to make antibodies, which is what they're always measuring after a vaccine, sometimes it's too late, or you get these massive responses that are kind of a 911. Your body's trying to rescue you as you're, getting sicker and sicker. You've failed that initial defense of the T-cell immune system. But I think for kids and healthy people, that natural immunity, when you have adequate vitamin D status and you're basically healthy and well-nourished, you'll do just fine. And
also the point that when, with innate immune system, you're starting to get sinus drainage and you're coughing and getting a little mucus up. I mean, all these things are normal immune. It means your immune system is actually functioning, and a little fever. You're burning off, the toxins, and you're clearing out. The body's trying to get rid of this, and that's a normal, healthy response.
Yep, absolutely.
Yeah, so you don't need to be afraid of it.
Nope. Do not. You don't need to be afraid. Fear is, I'm sure you know this, fear is stress, and stress is bad for your immune system. So, it's almost like I don't know, all this fear mongering and keeping people living in fear is hurting them more than anything.
Yeah, exactly. I mean, I can't agree with you more. Well, Dr.
Yeah.
Paul, it's been such a pleasure to have you on the show. And I urge all the listeners to go to drpaulsfight.com. That is drpaulsfight.com, drpaulsfight.com. And learn a little bit more how you can help against all these medical board attacks that he's currently dealing with. And it's not just it's kind of like what you're going through is an example. If they're beating you, then they can just kind of keep doing it to the next one and the next one and next one. So we got to draw a line and take a stand. And by taking a stand, they recognize, maybe we can't do this so easily. There are more people out there that are willing to say no to this kind of behavior, and then they have to pull back. So that's why it's so important for us as individuals to stand behind, like Dr. Paul, to stand behind and assist them and help them to fight this fight so we can all do it together and say no to this inappropriate behavior that's taking place all over the country. So thank you, Dr. Paul. I really appreciate you being here.
Thank you so much, and thank you for having me on your show. God bless.
God bless. That is it for today. Listening to Health Made Radio. I am Dr. Michael Karlfeldt. Remember, check us out at healthmade.co. Health is what you make it.